Okay, welcome to the Small Business Briefing. I'm Brian Calley, CEO of the Small Business Association of Michigan. This is actually briefing number 229. So we've been doing this for quite some time, and wanted to just do a quick rundown of the things that we're going to talk about today. So we've got a special guest. We're going to talk about a new education study, give us some insight into what's been happening in our primary education system. And I'll say it's tough. The results are difficult, but maybe not unexpected. And so we're going to talk about that. Of course, we're going to talk about the Supreme Court decision that came down just in the last hour. Talk about some of the numbers that are happening with the Omicron wave across the nation, around the world, some glimmers of hope, perhaps, and if we have time, a few other topics. So I have with me as my co-host today and partner in this endeavor, Sarah Miller, VP of Communications and Marketing here at SBAM, for our sponsor recognition.
Thanks, Brian. Thanks for those of you who have joined us today. You know, on Thursdays, if you're a regular viewer, we like to take a minute to welcome a new member. And today we're welcoming our basic member, Dave Bowen Trucking, owned by Jody Bowen, and they are located in Sterling, Michigan with 39 employees. So welcome to Jody and team. And again, we're welcoming them on behalf of our sponsor, the Marana Group. We have a busy show today, as Brian outlined. And before we get to our special guest, we do have some breaking news on the Supreme Court vaccine mandate.
Yeah, the Supreme Court made their decision. Basically, it's a split decision. And if you want to get the details on what they decided, just rewind or look at our Monday show and look what I predicted would happen. And that's literally exactly what happened. So, not to brag, but there's but I think that the decision to strike down the mandate from OSHA, just that it was outside of their statutory authority to essentially use the Occupational Safety and Health Administration as more of a public health body. That was a fairly, based on the line of questioning, a fairly predictable outcome, but upholding the healthcare mandate where there was more clear statutory authority for the departments to do so. I thought that the justices basically showed their cards in the way that they asked the questions. And while I thought maybe we'd have an answer by Tuesday or Wednesday, it came a little later than I thought, but along the same line. So we'll talk a little bit about what that means a little bit later on. But in the meantime, I want to introduce and welcome a guest to our show. And we were talking beforehand that I think that Professor Strunk is probably the smartest person we've ever had on the briefing. But there's a new study from Michigan State University and talking about our primary education system and what's happened throughout this pandemic, and specifically with remote education as compared to in-person. So Katharine Strunk is a professor of education policy at Michigan State, and also Erickson Distinguished Chair in Education and the faculty director of the Michigan State University Education Policy Initiative Collaborative, and her PhD from Stanford. It's not in your bio, but a mutual friend of mine told me that that your BA was in Princeton, and you went to Juilliard at the same time that you went to Princeton.
I did.
And, yeah, that's pretty impressive. Now, not to brag, I went to Lansing Community College and Michigan State at the same time, practically the same thing. But welcome, and maybe give us some insight. You've got a long-term study, deep dive, and put out a report recently. Tell us what's the most important takeaways we should take from that report?
Yeah, so just a quick bit of background. So this study is looking at student achievement growth on the benchmark assessments and the M-STEP assessments that were taken during the 2021 school year. And this is really important because the state did a great job of requiring benchmark assessments for districts. And so we actually have data to look at during the pandemic, which some states don't. So we had a report that came out in August that showed what we kind of all expected. Growth was slower on average across the state on the benchmark assessment reports. We did not see learning growth at the same rates that we would have seen in a normal pre-pandemic school year. This report builds off of that, confirms that looking at the MSTEP growth from 2019 to 2021, we didn't have 2020 test scores for MSTEP, and compares that growth to the growth pre-pandemic from 2017, 2019. And we see substantially smaller growth across the board for students who were educated during the pandemic relative to pre-pandemic. In particular, we see that low-income students, students of color, and actually women were less likely to gain during the pandemic. This was concerning to us, but not surprising. It does echo what we have seen across the country and other states that do have data. And so what this means is that pre-existing achievement gaps that were already in place in our school system before the pandemic, have actually grown wider over the course of the pandemic in ways that can be quite alarming. If you think about what this means for the economy going forward, there have been some estimates around the country that suggest, and this is not in the report, Brian, but that suggest that there will be billions and billions of dollars in every single state's impact on the economy because of the learning slowdown that has happened during the pandemic. I should say, as Brian, you hinted at earlier, districts that offered in-person education fared better than those that offered remote education during the 2021 school year. We estimate that for every month that a district was operating remotely, about 1% fewer students scored at a decent, in a high enough way. In fact, 1% more students scored significantly behind grade level, which these assessment vendors often talk about as sort of 2 or more grade levels behind. So if you think about school districts that were remote the entire school year, 9 months, they would be 9% more likely to have students who were significantly behind grade level. So that's sort of the bottom line of the report. It is really troubling, and I think it points to substantial overall implications, but also equity implications for the state.
Yeah, and I think that's it kind of tracks with a lot of other things that we've seen. Obviously, the pandemic was massively disruptive, but in a lot of ways, it wasn't new disruption. It really made old problems bigger, and kind of made more acute. And so maybe if you could flesh out a little bit more, dig into the achievement gaps, and whether or not we should expect that those achievement gaps, do you have any way of knowing if achievement gaps for those in remote learning situations, like at the moment, are schools getting better at remote learning? And so we think, maybe those achievement gaps wouldn't be as bad, or not. I mean, I just read a news article that remote learning in Detroit public schools was being extended out to the end of this month. They started out that was just after Christmas, and then extended now through the end of the month. And so, is there any reason to think that schools delivering remote education in ways that kids can absorb and learn, is that get any better, or are these kids that are still in remote situations likely to continue to fall behind?
Yeah, that's a great question. I don't want to make a blanket statement. I don't really know what DPSCD is doing with their remote schooling. They did put they're one of the districts that sort of shown in the 2021 school year for putting a lot of effort into developing teachers' capacity to deliver remote instruction. So they may have done a great job this month, and I don't think we know yet. As a whole, it's likely actually more disruptive this year than last year. And the reason for that is because it's uncertain. Kids are going back and forth in between remote schooling for a day here, a day there. A lot of kids don't have their computers at home with them, their one-on-one computing devices, as opposed to last year where there was a real effort to make sure that all the students had those. They aren't so used to being on Google Classroom or Zoom or whatever they're doing for their learning management system. And so my guess is, from what we know about the research pre-pandemic, little disruptions are really problematic. Big disruptions are really problematic. And this is sort of a big disruption when you learn the morning of or the day before that your school will be remote for the next 2 days. My guess is that there's not a lot of remote learning happening in some of the districts on those days.
Yeah, and I think that anecdotally that does fit with the just the reports. We have 29,000 members, or just shy of 29,000 members, and a lot of them are parents, and so trying to manage through this and experience throughout the state has been that when it is back and forth, it just makes the workforce issues and management of time that much more difficult and disruptive. So as we think long term, though, I wonder any insight about those who have made the transition from high school to university or college. during the pandemic, how those students are doing? Are they getting along any worse or better? Any insight there?
We haven't studied that at Epic. I think there have been some studies that show that there's a much lower matriculation rate, especially to like community colleges during the pandemic. It's been a pretty big decrease. There's a recent NBER paper out, happy to send you all after, that sort of tracks nationally the trends. And I think we've seen something similar in Michigan, from my understanding, where we just have sort of attrition from the education force, and they haven't come back. We all sort of thought maybe they would come back in this year, and it hasn't seemed to happen that way. So that has strong implications for, again, the economy, as we have a less educated workforce coming out of the pandemic.
Well, I really appreciate you taking the time to tell our members about this. Is one of the things that at SBAM, where we really do take a holistic approach to the issues that create a good environment for success in small business are also the same issues that make strong communities, and having people that are well educated and capable of taking advantage of all the opportunities that a global economy has to offer. This is a real cornerstone of it. So I appreciate your work in this and your career that is dedicated to something.
My pleasure. And I do want to give a shout out, Sarah, we promised we would do this, to Bridge, Michigan and Chalkbeat, because they've been doing great coverage of this that I think is probably informing your readers, so your members. And so just give that a quick heads up. Thank you for having me today. I appreciate it. Good luck with the rest of your time together.
Thanks,
Thank you.
Catherine.
Goodbye.
I did
great.
drop the link to the Bridge, Michigan article in the chat for those of us, watching on Zoom, and we'll make sure it's on Facebook as well. So excellent reporting by Bridge, and excellent report by Catherine.
Yeah, that's how we came across it, was that Bridge article. So I read the article, and then, it's not like I'm thumbing through Michigan State education studies in my free time. It was Bridge. They've done a really nice job of covering things and throughout the entire pandemic. And this is just one area where they had gotten a hold of this and did a really nice article laying out these issues. And it really goes to show how long a tail there'll be on some of the issues that we'll be dealing with this pandemic, workforce issues for decades to come. Yes,
definitely something serious that we all need to pay attention to. But I do know in your free time, you like to listen to the Supreme Court hearings. So let's go back to the breaking news that happened just before we went live here today.
Yeah, so we have a decision. So for most of you that are watching, the decision is such that the vaccine testing and mandate, or vaccine mandate and testing mandate, will not apply to you, and that's going to be a big help in terms of creating certainty and avoiding the types of workforce challenges that we were concerned about. Here at SBAM, we had 1,411 members that we thought would fall under this vaccine mandate, and they also were pretty clear in their rule that they intended to expand it on, or they were actively considering expanding it to smaller employers. But by a 6-3 decision, they have struck down the OSHA mandate, or the OSHA rule. And that included all the justices. The one that, if you might recall, if you go back and listen on Monday, the one that really surprised me was that John Roberts even seemed very skeptical about OSHA's authority to do this. And so that was the 6-3. I said I thought it would be 5-4 or 6-3, and John Roberts being that kind of swing vote. Now on the healthcare side of it, they upheld it for most, and I haven't had time. It just came out to really go through and see. But based on what I heard last week and the fact that for most healthcare workers it was upheld, my guess is that in the 12 or 13 or so statutes that were more explicit about the director's ability to add this condition of reimbursement to healthcare providers receiving Medicare or Medicaid payments, that those would be upheld. And there are a few statutes that represented a much smaller percentage, maybe 2 or 3% of the overall healthcare workforce, that maybe would fall outside of that mandate. So the healthcare portion of it stands. OSHA struck down, and that's the last step. There is, of course, there's no step above that. There could, if Congress passed a law and the president signed it, then it would be a different type of a story. But in terms of the legal challenge to this OSHA rule, it's done. And so what this means for your business is that you can now kind of settle back into paying attention to what the state health department and public health and state OSHA says, and our department of the OSHA department in Michigan. So there's a local OSHA department. I think that they had made it very clear before that they were going to match exactly what the federal rule required. Now that the federal rule goes away, I think we go back to no COVID specific Michigan OSHA rule. They could still try to do something, but I'd be really, really surprised if they did.
All right, well, thanks for that breaking news. If any of you are looking at our website, things still need to be updated, so we'll make sure that's taken care of here when the show is over. I do want to switch gears. It's not Data Monday, but we're still seeing record high numbers being reported. But with this, are we seeing a glimmer of maybe good news coming out of the UK and even New York, closer to home? What can we take away from Michigan?
New York really does look like they've already hit their peak and they're on their way down. And or the United Kingdom, now the New York City looks very much like it has peaked and plateaued, and maybe is ready to start coming down. Chicago as well, kind of showing that it's rounding off a bit. So looking at those and kind of this lag time that we've seen, it's not as clear in Michigan when our numbers started to rise, because remember, we were still in the middle of a Delta wave, like not in the middle, it was starting to come down. So we were past the middle, but the Delta wave hadn't come down that much before Omicron really kicked in. So that kind of masked, we don't know exactly when our increase went up, but let's say it's 2 weeks or so. Or later than when it started to really hit and take hold in New York. That would tell me that we're a couple weeks in Michigan away from kind of cresting. So a glimmer of good news, some hope that maybe we're getting closer to the end of it. I even heard Dr. Fauci in an interview had suggested that Omicron will get to most people, and certainly looking at the waves and knowing how many cases are untested because they're mild symptoms or no symptoms at all, then it stands to reason that there's a lot of there's some growing confidence that we're heading more toward the endemic phase, where it's more like a seasonal type of a situation. There's still a bunch of risk out there. Viruses aren't always predictable. But as difficult as this situation is right now, in the kind of epidemiology circles, there does appear to be growing confidence that the wave of natural immunity being spread across the population with this variant is one that it's tough right now, but could be helpful in the future in ending the pandemic phase of this crisis.
So what's the story with the hospitals, though? Are there still some serious issues going on there?
Yeah, in the hospitals, there's two things that I would point out. Is that there's still a lot of hospitalizations from the more serious previous strain, Delta, which had more severe symptoms to it. So that's part of it. Our hospital numbers hadn't really come down before Omicron hit. And then it's the law of large numbers that kicks in. I did notice that the CDC director had taken a lot of flack on some comments that talked about a lot of deaths were tied to people with 4 or more comorbidities. And she took hits from the right and she took hits from the left on the statement. But I think it was kind of taken out of context. I think the main point being made is that the vaccine protects almost everybody from serious illness. Those with the vaccine that died tend to have multiple comorbidities. 75% of those had more than 4. And so I think the main point there, it's not, that's, of course, that's a tragedy too. But the main point being that for most people, that they can have a lot of confidence that even if they get COVID with the vaccine, that the chances of them having a serious outcome are very, very small.
Okay. All right, let's switch gears and talk a little bit about at-home testing. So I feel like at-home tests are still a little elusive. They're hard to come by right now. But recently, President Biden announced that beginning Saturday, private health insurers are required to cover up to 8 home tests per month for the insured. So how is that going to work?
Great question. And the answer is we don't really know. And even a lot of the people charged with doing this don't know exactly how it's going to work. But basically what is in place now, and probably citing authority from previous coronavirus acts, there's the Coronavirus Response Act, the first couple of acts that passed under the Trump administration, I believe, did have some authority for requiring insurance companies to cover tests. And so it could be that this is not clear, that the Biden administration kind of reaching back into those acts and saying, here's the authority for doing this. Now, the idea of covering tests through the insurance company, mechanically how that will work, it's not very clear either. So apparently there will be pharmacy partners that will offer these tests. I think the intention is to try to get to a point where you come in and get the test and they bill your insurance for it, but it's not likely that that's going to be set up straight away. And so if you go in and look for the for tests and you're able to find some and get them, I think at least on the early days, it's more likely that you'll be in a situation where you have to pay for it and then you go back to your insurance company for reimbursement. So the other thing I'll say just about availability of tests, where you live matters a lot. I mean, population centers are running quite short. I have heard kind of anecdotally, but enough to where it kind of adds up, that in rural areas, there's a lot less demand for tests. So pharmacies in rural areas are more likely to have some available on the shelf if you really need to get one and want to go out of your way to do so. But this requirement, there's one piece of this which I think is potentially problematic or troublesome from our perspective as being an organization that pays attention to the cost of benefits that are offered, is that it's not clear, does the federal government plan to reimburse insurance companies for this cost, or are insurance companies going to in turn work it into the rates that employers pay in the future? That's that's an open question, one that we're pretty concerned about, because the one thing that's not required here that would be normally required in drawing benefits from insurance company is to have a medical professional say that this is required or necessary. So you're able to go get one without any kind of prescription or order or anything of that nature, and so that there isn't like a control on necessary other than the limit, which is for a family of 4 would work out to be 32 of these per month. So are they planning on just the insurance company pays it and then the insurance company bills back employers for the cost, or is this something that the federal government is planning on reimbursing so that it's just kind of a wash? That's a question yet to be answered. So this was rolled out pretty quickly, supposedly is going to be operational on Saturday, but I think fairly unlikely that you'll be able to walk in and get them for free. I think it's more likely that you'll be responsible for getting the reimbursement from your insurance company.
SBM Senior Vice President Scott Lyon did put together a Q&A of what we know now about the plan for these COVID tests. So I did drop the link in the chat and you can take a look there. We'll continue to update that article as we know more about the process. So thank you, Scott, for doing that. All right, we have a few minutes left, so let's switch back to keep talking about federal policy and federal spending and inflation.
So we are seeing, more, not that we needed more evidence, but, more confirmation that we are at a 40-year high in inflation that is persistent. But we are also starting to see some reason to think that maybe it's not going to get worse. And that I put that in two categories. First is that the Federal Reserve is indicating now on multiple occasions that they would expect to normalize the monetary policy. So, having the Fed funds rate so low basically it's just not necessary anymore. So the chair of the Federal Reserve had indicated that perhaps as many as 4 rate hikes, because they usually happen a quarter at a time, so a total of 1%. That would still keep interest rates at historic low levels, but would get them off zero basically. And so that is something that shows that they're actually seriously taking action, or they're planning to seriously take some action to combat inflation. And then on the federal spending side, there was some talk of for the changes in the Voting Rights Act, doing away with the filibuster. Now, if they did away with the filibuster for one reason, then it's kind of easier to do it for other reasons. And what would that mean potentially for federal spending? Well, they're not going to get rid of the filibuster. Senator Sinema had kind of more forcefully stated today, just not going to do it. Hasn't changed her position on that, and they won't have the votes to essentially change that rule. On another day, we can talk about the role that the filibuster has played kind of in U.S. governance for another time. But what I think that does is it really does, by closing the door on the filibuster, it closes the door on anything that looks like the Build Back Better plan before. So we already saw Manchin right around Christmas can close the door. Now we have another avenue they could have explored in terms of the filibuster, doing away with that, lowering the threshold for getting it passed and out of the Senate, that door being closed. And so I think we're in a better position to see federal government spending start to settle down a little bit, which would be good too. So you put the normalizing of monetary policy together with the federal government's higher than normal spending constrained, then I think it's not like inflation is going to go away tomorrow, but there's good reason to expect that it wouldn't get worse before it gets better.
All right, well, we're talking about spending. Let's talk about state revenue real quick in our final 2 minutes. What's the update you have from here in Michigan?
A few times a year, the revenue estimators, the fiscal agencies in the House and the Senate and the state treasury on behalf of the governor get together and do what's called a revenue estimating conference. And what is likely to be, tomorrow is one of those revenue estimating conferences. What is likely to come out of that is that the state is yet again billions of dollars ahead. The House Fiscal Agency had published their numbers. These will change a little bit because they'll come to a consensus with the other agencies. But the state saw 2.6 billion more in the fiscal 2021 year than previously forecasted, and then they're estimating 1.7 billion more in revenues for the 21-22 fiscal years. So all the things that are happening, like with inflation and so forth, and increased spending on things, it's like it finds its way into state revenue. So the state government has a lot more money to operate than they've ever had in the past, like by a lot in terms of the overall size of the budget they have to work with. The other thing that they put out in part of their pre-report was that which income revenue streams were up. And the state has a lot of revenue streams, but some of the big ones that were up. Income tax revenue overall was up 12.4%. So at the regular income tax, and most of our members would pay the regular income tax as a pass-through entity, so the individual income tax. Corporate income tax revenue was actually up 54%. And so this is the C Corp tax. So they pay 6% on profits. That would indicate actually that the profitability level was up as well. And sales tax grew by 14.7%. And use tax, which kind of pair together a lot of times with sales tax, but use tax up a whopping 66%. So really, these aren't type of numbers. Just never seen anything like this before. And I know that we've said that before about state revenue, but it's continuing. And so you'll see, I think probably the main thing that you'll see out of state policy that gets done this year, even though it's going to be an incredibly difficult, complicated political year with re-elections and redistricting and the House and the Senate up and the governor up and everything, a lot of turmoil with that. But the budget itself, and then there's a bunch of money still on the balance sheet, yet some federal dollars, think about $7 billion worth left unspent from before. So I think probably the appropriations area is going to be the one to keep an eye on for the next 6 months.
That is a lot of money. So we will certainly keep an eye on that and keep reporting out. That is all we have time for today. We appreciate you joining us, and we will see you back here on Monday at 3 p.m.
Thanks, everybody. See you on Monday.